The supply of lateral flow tests is not keeping up with the demand. Customers are having trouble both online and in pharmacies.
Second chemist today, yeah, none at all.
And pharmacists have been limited to one box of test kits a day.
At the start of the day, I'm going to say we had about 50, and that was just what was left over from last week. And now we have none. So they go out pretty much as soon as they come in.
The Health Security Agency says Christmas has disrupted the supply chain.
Obviously, as the Christmas period subsides, then the testing capacity should be more available to them. We do have good supplies, and we will be endeavouring to get those to the right places.
Okay. Well done. Fantastic.
Although cases are still rising rapidly, more than 90% of those in England are now the Omicron variant, and the Prime Minister believes new restrictions are not yet needed.
It is obviously milder than the Delta variant, and we're able to proceed in the way that we are. But that's one reason, and one reason only, why we're able to do that. And that's because such a huge proportion of the British public have come forward to get vaccinated, and particularly to get boosted.
In Scotland, the First Minister said there would be no changes to restrictions yet, but the government there was considering reducing the 10-day self-isolation period for positive cases.
These are finely balanced judgments, and we are considering the current trends in infection carefully. However, I can confirm that we do hope to reach decisions in the next week, with any changes taking effect from the 5th of January.
In England, the self-isolation period has already dropped to 7 days. There have been calls to cut it to 5, but even though the NHS is struggling for staff, its leaders are wary.
It would potentially be quite helpful to reduce the staff isolation period, because it would bring more staff to be available to work. But if those staff were to be transmitting COVID-19, then that would clearly be the opposite of helpful. So really what we need is the science to tell us what the best way forward is here.
And it's just not there yet.
That's right. People are working on this at the moment.
This evening, the Health Security Agency said testing capacity is being expanded, and nearly 8 million test kits will be made available to pharmacies by New Year's Eve.